over the past few years. The last time we were here, so many advances have happened in medical technologies, and so many things that seemed like science fiction have become a reality. I remember sitting in one meeting where we're discussing just soon after COVID hit, and there was a consortium put together through the DSI and the MRC, and somebody was discussing that mRNA vaccines really do look like something that would not be a reality in the next 5 to 10 years. But here we are. I suppose many of us have been jabbed those. So there's been an acceleration in these technologies, and what the proverbial disease X seemed so far away, and we saw COVID come onto our shores. And so what we want to discuss today is how do we then see these technologies as they have developed, and from an African standpoint, how do we respond to these technologies as they have been used, and how can we prepare ourselves for the next pandemics, and how can we make sure that our innovation ecosystems are able to respond to the deep challenges that we have in health, but also that we can effectively address those. So to help me unpack this topic today, I've got a stellar panel of 4 gentlemen, 3 of whom are here and one who's joining us online, who will speak from their perspectives of the world and from their worlds about what is happening with advances in health technologies. And so we have got Wayne Barnes. Wayne is from Illumina. He's the territory manager for the SADC region. And his goal is to unlock the power of the African genome by enabling access to Illumina's genomic solution in Africa. And his dream is for Africa to have access to its own genomic data. Then we have got Dr. David Calandra, who's online and is joining us from Turin, Italy. And his research interests cover new technologies and in areas such as blockchain and artificial intelligence, as well as their use in the health sector. And we also have Dr. Skhumbuzo Ngozwana, who's the CEO of Kiara Health, which is a South African-based healthcare company. And his work really is centered around the development of pharmaceuticals and is consulted for the World Health Organization, and is also chair of the board of BioVac, which is a vaccine manufacturer based here in South Africa. We also have Professor Habib Nurbai from the University of Johannesburg, who's a much sought after speaker in both on TV and radio. Some of you would have seen him in the areas of health, and it's just as trivia, he was Mr. South Africa in 2017. So I will allow David to start first online to just give us his presentation, and then we'll move on to Wayne before we get into the engagement of some of the panel that are here today. Are we okay for David to join us?
Thank you. Thank you. Can you hear me well or not?
Yes, we can.
That's great. Thank you very much. So, it is an honor to be with all of you. Now I can see my screen double. I don't know if it is all okay. Perfect. So I start sharing some few slides of my brief presentation. And before starting, I would like to thank you all of you for the organization, and obviously for inviting me in this presentation. Let's see if okay, so now you will be able to see my presentation, hopefully. So the great challenge that is about this special track, and obviously one of the key teams important around the world is the tech health. It means how advances medical technologies may be helpful for the future of our health within the world, so in our countries, but obviously in all over the world. And before arriving in some more information, I would like to bring your attention on some numbers. So particularly here, you can see some data about the most funding health technologies worldwide. So when we talk about advanced technologies that in healthcare, we must consider such elements, particularly telemedicine, data analytics, mobile health applications in general, clinical decision support, practice management solutions, wearable solutions, wellness applications, and healthcare booking parts, software, and social health network. So as you can see here, we are facing from a new era for new technologies in healthcare. Here we have data of 2020, so we are in the middle before basically before the COVID-19 situation, because they are referred to 2019. And as you can see here, even before the pandemic situation, we are basically consider about investments about 4,260 millions of dollars for telemedicine and so on. Therefore, when we talk about medical technologies, we need to consider such keywords, such elements. Obviously, you can then have the idea, the opportunity to improve your knowledge, your skills about one of each one. But we need to keep in mind such keywords. Obviously, one of the most important technologies, let me say, but instruments that we can have for health is artificial intelligence. Here, I would like your attention on a recent publication that we have with other extreme colleagues around the world about the role of artificial intelligence in healthcare. Here, with the colleagues, basically, we study how artificial intelligence may be helpful for healthcare, for patients, but also for back office activities, etc. And what I love to know you and to tell you is that artificial intelligence, if programmed well, can help and can give a valid solution and valid help to physicians, but also to administrative sides. And particularly as we write, artificial intelligence systems are set to transform the way we think about the diagnosis part and the treatment of disease. Particularly, we can summarize, we can classify several opportunities that artificial intelligence can give us. For instance, robot-assisted surgery, or we can obtain the discovery of new drugs. We can enhance the process of diagnostic image. We can analyze more data with the electronic health record. We can also achieve remote technical assistance to electromedical equipment. Just thinking about remote geographical zone of our countries, of our nations. And obviously, patients need the health support also in a remote zone. And obviously, also telemedicine part. It means remote patient monitoring, supporting them using webcam, using microphones, etc. All of this data, all of this set of data, obviously, then create artificial intelligence. And obviously, the common support between physicians, between management people, between obviously informatics can enhance and can help patients from here and for the future. So one of the most interesting problems that we are facing within the European countries, particularly during the COVID-19 pandemic period, is the decline in the number of doctors and the need for new solutions. So the real problem is that in such countries as also in Italy, I can bring our situation. The real problem is that the first face-to-face doctors, so the first clinics part, are needed of new resources. But at the same time, it's not so easy to find people that want to start this process. And the real problem is monitor patients, give them informations. And therefore, technology obviously can help in this process. Here I can give to you some data about the leading medical technology market. The leading country in Europe is Germany, with 25.6% of technology market, of investments within technology health. At the same time, we can see that within the European countries, the medical device annual market grow year per year by 8.5%. And at the same time, an interesting KPI, key performance indicator, is the number of patents that are registered within the European countries. And before the COVID-19, we have 10,475. The real challenge is to communicate with technologies. It means that we have a lack of human resources in some parts of our countries, but at the same time, we need for new solutions as artificial intelligence or other elements. And giving you an idea, a more precise idea about benefits of technologies for health, we can assume, for instance, that with new technologies, with artificial intelligence, for instance, we can proceed huge amounts of health data. It means that we can monitor patients. We can also predict their ability, their conditions for the future, 1 week, 2 weeks, 1 month, and also per years. So we can use such important tools to monitor our health, basically, for the futures. At the same time, technologies can help us to reduce medical errors, because we can proceed more data, we can obviously benefits from technologies also in understanding if something gets wrong. At the same time, new technologies allow effective medical decision making, because give us the opportunity to see more health stories. Technologies can give us the opportunity to see more stories about our patients. At the same time, we can obviously improve quality of care. We can give to particular patients tailor-made care, because we know the patients. We can follow patients around the history, and we can obviously achieve better diagnosis. We can also save time in taking obviously health measures, so in adopting health strategies, but also to manage patients in the back office parts. At the same time, obviously, we have the opportunity to generate new knowledge. We can use, for instance, telemedicine tools between countries. We can exchange, we can share knowledge management between countries, and we can basically create a common flow of medical parts. And at the same time, new technologies, obviously, if managed in a good way, can allow continuous assistance to medical staff and patients, and obviously allow to achieve a sort of effectiveness in monitoring care. Here, obviously, we need to consider all the positive factors. At the same time, I would like to give you the idea, obviously, of the problems that new technologies can have. Here, I can see two main problems. The first one is related to the technology acceptance model by physicians, by nurses in general, but also patients. So what we need is a path between physicians, between patients, between obviously informatics, management people, etc. People must accept these new technologies. It is not so easy to manage for particular categories, for instance, children, for instance, other people. And one of the most important key points that I would like to highlight in this presentation is the data quality, because we talk about artificial intelligence, but without data quality, artificial intelligence is impossible to achieve. And at the same time is data security. Here, particularly in our countries, within the European countries, we are facing several problems about security, data security. So governments, health institutions should, and let me say must, because you are dealing with health data, patient health data, you must achieve the highest security measure of obviously all the patients that you are managing. It is clear, obviously, within our European communities, and they are trying to invest much more money in defend, obviously, patient data. But at the same time, we need to do more to finalize this system and give, obviously, to these new technologies the ability to cover all of these elements. I would like to to say thank you for all of you. All of these research are part of a particular research team. We are basing at the University of Turin, Department of Management. Here I can leave my email. If you have any, obviously, question about this presentation, I am free to answer to you. And thank you another time.
Thank you so much, David. I'll proceed to those in the room. I'll invite Wayne to come and speak to us and go through his presentation. I'll invite us to have questions after everyone has given their prep talk. Thank you.
Thank you, Osmond. So, good morning. No, it's afternoon already, not yet. Good afternoon, ladies and gentlemen, and thank you, Osmond and organizers, RICELE, for giving us the opportunity to present today. So just to share with you what Illumina does, I'd like to share a few slides. Our mission, although it sounds simple, it's quite what is driving us every day with every customer interaction we have, with every pandemic we face, and for every customer visit call we have. It's really to ensure that we unlock the power of the human genome and to improve human health. So it's a simple two-line statement, but I think that is sort of what we live and breathe every day through every interaction we have, whether it be with customers, scientists, drug manufacturers. That is really what is helping us to drive innovation for the future. So Illumina has been founded in 1998. We currently serve more than 8,000 customers across 140 countries globally. And through our technology, we've been able, scientists and researchers, to drive forward their research and innovative ideas. And the result of that has been over 400,000 publications since our inception. And if we look at the global install base, we've got more than 20,000 systems installed globally. So Illumina provides next-generation sequencing platforms and microarray technology that enables whole genome sequencing, resequencing, and genotyping. We do this serving our customers in a broad range of fields, whether that be in oncology to sort of spearhunt and look for the next generation in oncology drugs, to understand the tumor environment, in genetic diseases. I'm not sure who of those have been following the news regarding the rare disease and treatments that it's needed for that. So really to understand rare diseases in a much better and a broader context. Then in non-invasive prenatal testing for reproductive health, making sure that we can limit invasive procedures and do prenatal screening. And then if we look at population genetics, that's really to understand in the context of the African genome what the complexities are of what our innate immune systems are looking like, and to guide future drug development and therapeutics towards making sure that drugs are developed for our African population. And then I'm sure this goes without mention with regards to public health and surveillance efforts. Here I can just but mention COVID surveillance that has been really at the forefront and very much highlighted in the discussions we've had today and what we've heard this morning. So how do we really enable these breakthroughs, right? And that is through what we already mentioned in terms of innovation and how important that innovative landscape is. And I can here but mention one example, and if we think about the human genome, it has taken really decades to sequence the first human genome, and you can all appreciate the cost that was involved in that. Over $100 million spent to complete that project, right? And now where we are standing today, as what we are trying and successfully have been doing is to drive down cost. And that has been through the economies of scale. So currently we are sitting with a cost of $600 for a human genome. And if you are following the discussions, our CEO has also been committed us to chase the $100 human genome. So really these breakthrough technologies enables us to do rapid whole genome sequencing in cases of neonatal care where we need to make a diagnosis and understand, right through to development of the latest and greatest vaccine candidates and drug treatment therapies. So we've really been able to see how cost has come down and how we are chasing that next $100 target. So let me focus a bit on COVID surveillance, and what has been the success story that we can share there has really been the accelerated access to innovative technology in the African landscape. And I'm sure this goes without mention, the great work that has been done and also highlighted by Richard Gordon this morning on the NGSA network in South Africa. But if we took a bit of a broader look at that through the Africa PGI initiative, we've been able really to build ecosystems where there were previously none available or in a very limited time. So that has been really a great drive and achievement for us to work and collaborate. I think that's another word that has been resonating a lot, the collaboration there needs to be to build these ecosystems. And I think you can see on the board here that we've been able to equip 15 countries across the African continent. That's 18 labs, and we've added sequencing capabilities in these labs. So this was all amidst in the heat waves of COVID, and I think with regards to logistics, it has been a job well done. Together with that, Illumina has been at the forefront also to drive further this collaboration through donations to the Africa CDC PGI network of $60 million, and that will sort of help us accelerate and speed up over the next 5 years how we can change the landscape and have access of genomics available in the continent. So it's one thing to talk about innovation if we are living it right, but what is the next step for us? And I think this also once again highlights the need for continual collaboration and improvement in our innovation. So this is just two very brief announcements that we've made earlier this year in terms of new chemistry that we will be launching, which will increase our accuracy, make sure that we can get results even faster, and also in terms of technology advances allow us to generate more data with longer read lengths that we will have. So that all while delivering high quality data. So with that, I would like to thank you. This was just really a brief overview, but looking forward to the discussion at the end. Thanks so much.
Thanks, Wayne, for that illuminating presentation on Illumina. I'll invite Prof. Habib to come and speak to us.
All right, thank you so much. Just want to test if the mic's working. All right. So good afternoon, ladies and gentlemen. It gives me great pleasure to also provide an overview from an academic standpoint, but also where we are in terms of the Afrocentric market. So there has been a very good panel before us talking about the translation of research and how do we now take that into action, looking at various forms of medical device technologies. So my talk is mainly centered around healthcare technology innovation in the 4IR and the need for adoption, infrastructure, as well as education in the Afrocentric market. So the key question is, how do we continue to adapt and transform healthcare technology in the African context? And Prof. David just gave us a good talk from a European context, but from an African context, how do we transform this exciting development? So it's really important to understand the context from a South African perspective as well in terms of the social determinants of health. And the H002 is quite different from a number of countries. And we're quite aware of the determinants of healthcare from a South African perspective. But you can see from the slide that healthcare is influenced by the other sectors. So it's important that we have stability in the other sectors in order to afford a more transformative but efficient healthcare system from a tech perspective. What's also important is the Sustainable Development Goals that we're aware about. There's 17, but more importantly, the SDG 3 that speaks to good health and well-being, and from an academic standpoint, SDG 4, which speaks to quality education. So it's really important that we tie in SDGs 3 and 4, but more from an innovation infrastructure perspective, SDG 9 that speaks to industry, innovation, and infrastructure. So aligning our core goals, whether we're working in industry, academia, or even at government level, that it is aligned to the Sustainable Development Goal imperative. What's a really important report that came out in 2019 by the Future Health Index basically showed that the education or training of health professionals on how to use digital health records in South Africa was only at 37%. So there is a shortage of skills in training on the use of technologies and specifically digital health technologies for healthcare professionals. And what this provided is that there was a further rationale for training, right? So there's also in the IT sector, there were 30% of IT experts that require knowledge and application in healthcare innovation. And in addition to that, 25% of health professionals lacked training for health professionals to use new systems and new technologies within healthcare. And so from this report, there was a rationale that there's more universities and institutions require or encouraged to offer healthcare technologies, training, and skills so that the adoption can be accelerated within the Afrocentric context. So at the University of Johannesburg, just to give you a small overview, within our research center, which focuses on biomedical engineering and healthcare technology, we also not just focus on research and innovation, but we also focus on skills and training. And two programs that we currently offer. The one is the short learning program on healthcare technology in the 4IR. We take candidates at any level through a 10-week program showcasing a high-level pitch of the various technologies that are available within healthcare and how they can apply it within their particular university or within their industry or clinical or public health context. And what we're also currently developing now is the first online master's degree program in healthcare innovation and technology that will have a specific focal lens on the Afrocentric market that would be offered from 2024. So as much as training and skills are required with the Afrocentric market, we also need to look into what kind of solutions can we put forward to solve the most common challenges experienced in healthcare. So a lot of these solutions you probably heard about, but we have the Internet of Medical Things, we have electronic health records where we handle different types of patient data, either through digital health records or even in terms of various forms of cybersecurity systems, which is now aligned to the POPI Act. We've got blockchain technology that is really revolutionizing and adding value to the healthcare sector, used to secure patient data and also as a form of distributed ledger technologies, where we're finding various forms of use cases even within the healthcare sector and not necessarily only within the financial sector. 3D printing is also quite at large now within the South African context, and we're now seeing that it's both feasible and sustainable to have these forms of technologies within the healthcare sector. And it's not just used for prosthetic limbs or orthotic devices, but it's for even dentures that are required for the elderly. So we're starting to see that conventionally some of these medical devices or ambulation aids are quite expensive, and these alternative forms of sustainable materials through additive manufacturing or 3D printing has shown to be a sustainable solution. We have robotics, which is largely used from a European context or a first world context, and that's something that still needs to be translated within a South African context, but perhaps not at a larger scale just yet. And we're now seeing that robotic has been used within the surgical phenomenon among different types of surgeries. And then robotics from an assistive perspective, or from a care perspective, or a home care-based perspective. Obviously, this is a big debate on its own, where it can't really replace the human itself, but rather enable or assist the human in terms of doing various forms of assistance-based capabilities. And then we have virtual reality, which is not just used in skills and training, but also within various forms of healthcare. And we're finding that both virtual reality as well as augmented reality now has a use case, especially within the African context. And that's augmented reality. And then we also have drone technologies in healthcare, which has been used surprisingly in South Africa as well, and in Africa. So, and Rwanda was one of those countries that had been the leading forefront in terms of trying to address the need with regards to the food shortages within Africa, but also in terms of emergency medical rescue. We have a number of these prototypes that have been galvanized through San Francisco in America, as well as in different parts of Europe. But we even see now that in South Africa that there's a number of use cases for drone technologies within healthcare, either to assist in emergency care, in terms of patient samples delivery, or even from a pathological perspective. So lastly, one thing that we need to answer is, how can we tackle the issues of mass adoption and infrastructure for healthcare technology in Africa? I think we're beyond that point now of talk, but how do we really translate all of this into action, right? I think that's the key and critical point right now. So in the context of South Africa, we have a number of socioeconomic factors that we have to admit and that we have to be aware about. These are the challenges that we currently face. But the funding and infrastructure is required. Without this, you don't have the scale or the shell in order for you to enable and deliver on these number of innovations and technologies. So we do call out to a number of the industries, but even global partners as well, to provide funding and infrastructure on an African context. There's also a huge burden of inequality as well as inequity that has to be addressed. And as well as we can learn from our global North counterparts and European counterparts, we still need to understand, how do we specifically contextualize the needs that we need within Africa, and understanding what inequality means, but also what inequity means within the healthcare context within South Africa. We have a huge public health burden in South Africa as an example, and how do we lend itself through narrowing down that gap that we see currently with inequality as well as inequity. And those who are working within the technological and innovation landscapes, either as incubators, as research institutions, or even within the private sector perspective, the technology mindset is critical. And I think that's something that needs to be bred a lot early on into universities, or even before university in schools. It's important that we inculcate that mindset of technology and entrepreneurship, because when they come into universities, we are already seeing it as academics, that the grounded theory of technology and innovation is not really there. And it's important that we also try and shift our mindset to the other determinant within the society, that is education. And so the basic education sector needs to try and come and inculcate an ethos of technology and innovation for young school leavers. And then as well as the technology readiness levels, I think it's very important that we admit that if product to innovation is at the conceptual stage, it's not at the product market stage. And a lot of the time we say we have this fantastic innovation, but where are we in this TRL landscape? It's a huge process. I mean, I think that's something that also needs to be understood by various entities working within the sector. And then focusing on innovative best practices and an ethics of care. And I think that's one thing as well that shifts the focus outside of Africa, is the lack of ethics. And it's something that I have to bring up, because the level of integrity and ethics within healthcare innovation is really important. And if we're working within health sciences, medical ethics 101 always comes into play, and that is no harm to patients and ensuring best practices for the delivery of healthcare. And so innovation best practices is important to look into in any sector within the healthcare perspective. And then the most important thing for me is accessibility. We see a number of these innovations in technologies. We've heard of these other forms of cool and fun technologies that we can use in healthcare. But what is the accessibility like within South Africa? Do we have such accessibility within the public healthcare sector? And the larger answer to that is no. And so in order for us to provide access to public healthcare sector within the African context, we do need funding and infrastructure. And it's going to come down to those two main points. So in summary, health systems are in continuous transformation, as well as the healthcare innovations and technologies that all countries are adopting. The adoption of these technologies is a journey and not a one-time event. That is why, as the challenges and needs evolve from country and country and certain barriers fall away, healthcare professionals and students must adapt as they adopt new technologies, innovations, learning and adjusting as they go. So in summary, I'd like to conclude that change is inevitable. We're continuously residing in a change-based industry. Change is inevitable. Health has evolved and adapted through the digital and electronic ages. It is only a matter of time before healthcare adopts changes through the technological and 4IR age. Now is as good a time as any to adopt an innovation of choice mindset, as well as uphold standards for the upliftment of profound, innovative, and research experiences. Thank you so much.
Thank you so much, Prof, for that presentation. You touched on two matters that really tugged my heart, which is the issue of access, as well as the issue of the social determinants of health. We were in a health funders convention sometime earlier in the year, and one of the statements that was said was that, what is the point of changing or trying to bring these top-notch health solutions if we are not changing the environments in which the people are coming from, which authored the disease in the first place. So it's one of the things that we need to do as South Africa, not just to respond, or as Africa really, not just to respond by bringing in these fancy technologies, but also change the social determinants of health. Our next speaker is a man who is passionate about ensuring access to pharmaceuticals. So I'll invite Dr. Skhumbuzo Ngozwana to come and speak to us.
Thank you very much, Chair. I think you've done me a great disfavor by bringing me after all these very good speakers. I somehow feel like Jennifer Lopez's fifth or sixth husband on their wedding night. When you walk into that honeymoon suite, you know what's expected of you, but you just don't know if you'll be able to deliver. I think a lot of what I'm going to say has already been raised, so I think in the interest of time, I'll just skip those and just talk about issues that have probably not been raised. I think we've heard of the advantages of medical technologies. The key thing, I think, for me is when people think technology, they think it's expensive. We can't afford it, we don't have the skills, we don't have this, that. And as counterintuitive as it seems, actually, we need to adopt these technologies because they are what will allow us to challenge, to address the significant challenges that we face. I think Professor Kalandra mentioned some of these things. Technologies make healthcare affordable, there are better clinical outcomes, you have the possibility of remote patient monitoring, and a host of other good things that I'll talk about. So what I've done is really just to group the benefits of technology, and I'll speak about some of those things, as I said, points that I think I want to emphasize that were maybe not raised. So if we look at something like remote patient monitoring, one thing that you always forget when you talk about the cost of health is the cost to the patient. Remote patient monitoring allows you the opportunity to treat someone or to monitor them in the comfort of their home. They don't need to spend money on taxis or trains or whatever going to access healthcare. If you think of the Italian experience during COVID, they were able to triage and manage patients who were sitting in their homes. A very small probe, one on the finger, was able to give them saturation, an ECG, a host of other measures, including, whether the patient was lying down or not, respiratory rate, and they were able to call in patients that were sick or were starting to deteriorate and bring them into the facility. So the issue of reducing travel costs, I think, is one that is key for the patient, clearly the better patient outcomes and all of that. If you look at what they're doing in the US, for example, with telemetry, monitoring cardiac patients, patients go home, they have a patch. If something happens, there's a call center where people are monitoring this 24/7. If a patient starts to deteriorate or they see some dysrhythmia, they're able to call that patient in or send an ambulance and pick up the patient and bring them for medical care before something dramatic happens. We spoke about artificial intelligence as well. I think just to say, if you look at the practical applications, you could look at something like digital computational pathology. South Africa has just over 100 pathologists. If a woman goes to a clinic to do a pap smear, if that slide is not lost on the way to the lab, if the sample is not inadequate, whatever, chances are it will only be evaluated after 3 or 6 months. Digital computational pathology gives the possibility to digitize a slide and be able to read it by toggling artificial intelligence on your computer to be able to read that within 30 seconds and say there's cancer or there's no cancer. And clearly that leads to better outcomes. I've mentioned the issue of smart drugs or smart pills as they're called and digital therapeutics. If you think about smart pills, a company called Proteus were the innovators in this. You have a small chip imprinted into a tablet. You take the tablet and there's a patch that you wear on your tummy, on your hand, and that is able to tell you precisely when you took the drug, if you're standing up, lying down, whatever. It's obviously crucial for compliance for conditions like TB that we battle with on the continent. Then I think, Prof also mentioned the issue of augmented reality, which I'll come to, but just one other thing around, digital therapeutics. For the first time, the FDA has approved or authorized a digital treatment platform for kids with ADHD. It's called EndeavorX, and 73% of the kids that are treated with this thing, virtual reality tool improved. So again, you see some benefits coming from there. We mentioned the issue of robotic surgery. I think just to mention that with 5G coming into the picture, you now also have the possibility of basically allowing patients in remote areas to be operated on because you have this high-speed connectivity that allows digital operations to be done. Now, looking at South Africa, looking at the Da Vinci system and robotic surgery, over 500,000 surgeries are now conducted using this globally, and there's no reason why we should not also join that and be able to deal with the challenges we face. Machine learning and artificial intelligence were mentioned. Again, I mentioned the digital pathology, the computational pathology, but also being able to process patients who have, let's say, cardiac issues, whatever, where there's a remote wearable, that's one. The patient, if they're connected to the internet, they're able to send data to a central database that, using artificial intelligence and algorithms in the background and machine learning, can predict precisely if that patient is at risk of a cardiac event, whether it's, a SVT or whatever, and the patient can be brought in for treatment. One of the issues that was mentioned is 3D printing, which now gives us the possibility to print implants and robot and prosthetics, amongst other things. But going into the future, it also means that the possibility of organ transplantation becoming obsolete is there because you can do human tissue printing as well going to the future. I think cancer immunotherapy is one that, immunotherapy generally is one that's a significant advance. Yes, it's a little bit expensive, but obviously as you scale this up and you develop competencies, things would get better and you'd be able to literally target only the cancerous cells, and in some instances, when you treat, you are able to obviously then protect the non-cancerous cells. Blockchain technology was mentioned, security, cost implications, and the key thing is it cannot be hacked. One of the concerns that patients have about sharing their records, even with the best of the digital health records that we have, is security. With something like blockchain, this is secure and nothing can happen. Personalized medicine, critical. If you look at conditions like, in depression and whatnot, you now have the possibility, and and in cancer, you now have the possibility of determining who will respond to a particular drug, what dose they need to be on, and you can treat patients and make sure that those who are not going to benefit are clearly not exposed. The issue of medical wearables is one. I think if I had to hazard a guess, I'd say about 50% of the people in this room probably have a smartwatch or something. Again, great utility. We've been told that we've run out of time, so I think I'll truncate it there. The last thing that I wanted to mention was nanotechnology. But my last comment would be that medical advances and medical technologies are not as expensive as we think. I think it's high time that countries like ourselves really invest in this, because in the long run, the benefits are much better for everyone. Thank you.
Thank you so much to my esteemed panel for your contributions. We have to cut the session at this point because there's the Women in Leadership seminar that is going to start just immediately because it's being televised. But thank you so much for attending. If you do intend to confer with any of one of our participants, please see them after this so that we can have further engagements. Thank you.